Yep.
Hey everybody, Dr. Fedich here, Clinic Director at Village Family Clinic. We talked to you a little bit about hip pain. So we happen to have a bunch of patients with some hip pain this week. So I want to talk a little bit about hip pain today. So this is our friend skeleton here, and we're going to turn him around. We'll see on the side the hip joint. So this is the hip joint here. So a lot of times when I'm talking to patients, they'll say they have hip pain and they're pointing here, here, all different areas. So it can be kind of confusing. The real hip joint medically is this joint here, the ball and socket of the actual hip joint, which moves your legs. So sometimes people say hip, they mean here, here, all sorts of different areas. So the hip's a ball and socket, it moves around in there, and there can be all kinds of problems in there, including wearing out and tears and strains. But often the problems get a little more complicated. So take our little zoomed in model here now, with a little bit more detail. So there's that hip ball and socket we were just talking about. These muscles that are cut away here are your glute muscles or your butt muscles there. And then this guy here is your sciatic nerve. So where your hip might be hurting, the hip joint is right there. The sciatic nerve is only less than an inch away. All these glute muscles are right there, and they're very common to have glute muscle problems like tendinopathies and things like that. So in this small area where we think it might be the hip joint, it could be the joint, it could be arthritis, a problem in the hip, could be a tendon problem in those glute muscles, or it could even be some of the sciatic nerve in here as well. The other tricky part with the sciatic nerve is that the nerve roots come out of the spine here, so it could even be a problem up in the lower part of the spine running through that nerve. So all in this one area, there's 3 or 4 really key parts of the body right there. So what's really important with hip pain is finding out what's the cause of the pain. So all these are treatable depending on what's going on, but we really got to find out. Misdiagnosis can be a big problem. So step 1 with the hip is really finding out what's causing the pain. Is it the hip? Is it the glute? Is it a tendon? Is it the sciatic nerve? Or even the sacral joints or lumbar spine. So there's a lot of things in that small area that could be causing a problem. And the thing is, unfortunately, in modern society, we're sitting all day, so that can cause some problems there as well. So it's really important to diagnose your hip pain. Any of those problems are fixable unless the hip is totally worn out and you need a replacement, but we can help with all those other problems. So if you have a hip problem, give us a call at 908-813-8200.